hear about the symptoms, you don also hear wetin you go fit do so that this virus no go catch you for where you dey. You don also see say the government don put strict measures because of this virus. Because as e be, COVID-19 na serious matter o. Wetin average Nigerian really know about COVID-19? How average Nigerians wey dey different corner for Nigeria dey cope with this COVID-19 and how e dey affect people. COVID-19 citizens feedback don tanda to make sure say you sabi and you go talk your mind of how e dey choke you for liver, so government and other better agencies go know how to plan better things wey go fit help and satisfy the masses. COVID-19 citizens feedback wey be say na the ordinary president wey be Dr. Ordinary Ahmed Issa, na him go tanda to listen to you to get your feedback so that you go talk your talk, you go yarn your yarn every day from 8 p.m. for Human Rights Radio 101.1 FM Abuja. COVID-19 citizens feedback, dem must hear people because people life matter.
The COVID-19 pandemic is ravaging the world right now, and Nigeria is not excluded. You have heard about the symptoms. You've heard about the precautions to take. You're aware of the strict measures put in place by government to curtail COVID-19. But what does the average Nigerian really know about COVID-19? How are the average Nigerians in all the nooks and crannies of Nigeria coping with COVID-19 and its consequences? COVID-19 Citizens Feedback is here to engage Nigerians and meet the populace at street level to harness, engage their feelings and their yearnings so as to provide the government, stakeholders and policymakers the needed feedback to plan better and satisfy the masses. COVID-19 Citizens Feedback, personally anchored by the Ordinary President Dr. Ordinary Ahmed Issa. The program is here to bridge that communication gap and get the citizens' feedback on the situation live, uncut, unrehearsed, and unedited. It is going to be interactive and no holds barred all the way. Tune in by 8 p.m. every day. Yes, every single day on Human Rights Radio 101.1 FM Abuja to be part of COVID-19 Citizens Feedback. COVID-19 Citizens Feedback is sponsored by Open Society Initiative for West Africa, OSIWA. It is open for co-sponsorship and advert placement, just like other programs on Human Rights Radio. COVID-19 Citizens Feedback, the people must be heard because the people's lives matter.
All right, good evening, Gadi. Welcome us on Top COVID-19 Citizens Feedback here for Human Rights Radio and Television. My name is Maddox Maduka Ojimadu. They call me Simple Maddox because, yes, now me Simple Pass. I welcome us today for the program COVID-19 Citizens Feedback, that program. What would they use today? Rub minds today, Vano together, nose to nose, mouth to mouth, with our people everywhere for inside this our global village. I make they make sense on top of the issues where concern COVID-19. All right. Well, when the world still be the world before COVID-19 can't teach us bad thing. Today now we go on the shout to thank God is Friday, and some people to see house today go be like midnight or early morning tomorrow. Some self now for head they go carry them go back on top, say they don't go jolly. Well, but this period no be the time for that one, because this not the time. Make everybody whole body. They careful. Make we they protect ourselves, protect everybody around us from COVID-19. And I come make a talk say, make we talk say, thank God we are alive. Every day we come, we they alive. Everybody we they around us, they okay, they alive. Now, blessing from God, and we're not going to take them for granted. Of course, that one means we're supposed to do everything what we're supposed to do on top. COVID-19 make we day safe. All right, I believe say all of us they okay. So on that note, I welcome us on behalf of the ordinary president, ordinary Dr. Ahmed Issa. When I don't give me the chair, so make I hold them on in behalf. I make all of us they not together. They move forward, and the people where they sponsor this program now, Open Society Initiative for West Africa, OC. Of course, the program they open to sponsorship, advert placement, and of course, I make you carry your message come so that we go take and go meet our people for their domot. Well, one set of people don't buy into this our program now. The organization NGO, what they call Connected Development. Yes, this today now the 5th week where they come there with us to talk about COVID-19, and their focus now to follow COVID-19 money. In fact, their way now follow the money. Where the money go, where it go, how far with that money, we want to know before monkey hand go become human being own. But today they can't talk say, okay, if they talk money, it go be like say now money they important pass life. So today they come talk say, make they send somebody from the organization where go come teach us about issues will concern COVID-19, how to stay safe and everything. So today, they don't go just talk about money. They will just leave money first and make we talk live. So the person don't already day, but of course, now after we don't go break, come back, we go carry and begin, put mouth on top waiting, carry and come enter studio. But for now, make I begin to tell us the facts and the figures of COVID-19 for inside our Obodo, Nigeria. So, of course, make we start from the figures. All right, yesterday will be the 20th day of August 2020. NCDC tell us say they've been conduct 3,660 tests. All right, now the number of samples where they test 3,660, and from this number they come find 476 positive cases of COVID-19. So we've been record 476 positive cases of COVID-19 inside Obodo, Nigeria, as of yesterday. And then the bad news on top that one be say 7 people wait on the collect treatment for COVID-19 for inside Nigeria being die. All right, and these 7 people will die now from 3 states. Plateau State record 4 people, Osun State record 2, and then Enugu State record 1. Okay, so for the 476 positive cases where they discovered yesterday, Lagos State now them chop more than half, as they get 200. Okay, almost half, reach half, but nearly it be reach half. Okay, Lagos gets 235 confirmed cases of COVID-19. So that one had the lion's share of the numbers, and then the FCT come in second with 44 new cases. Kaduna get 41, Borno 33, Plateau 28, Abia and Edo State each get 13. River State gets 12. Imo 11. Oyo 10. Kano 9. Kwara 7. Enugu and Katsina each get 5, while Gombe and Ogun, also the two, both of them get 4. Then Nasarawa and Zamfara State, the two of them come DGG at number 1. Okay, that is they get 1 new case each. All right, so if we begin, they look into the total numbers of the cases where we record for Nigeria. Since we begin the count COVID-19 figures for Nigeria, Lagos State, of course, done they far ahead of everybody with 17,327 confirmed cases of COVID-19. And out of that number, 201 people don't lose their lives, and they don't successfully discharge 14,497 people. So that one can leave 2,629 people for inside admission for Lagos State. FCT, they follow with the next highest number with 4,881 confirmed cases. And for FCT, they don't discharge 1,407 people. Will be like 10% of waiting Lagos don't discharge. But the people who die for FCT now 46. So that one can leave us with 3,428 active cases for inside the FCT. Will be the highest for Nigeria for now. Number 3 now, Oyo State with 3,017 confirmed cases of COVID-19. And inside Oyo State, the people who still collect treatment now 1,319. The reason they say they don't discharge 1,664 people who don't recover, while unfortunately 34 people die for inside Oyo State. Number 4 for Nigeria, now Edo State, that state where they do election campaign. They don't get 2,475 confirmed cases of COVID-19. Out of that number, exactly 100 people don't die, while they don't discharge 2,206 people. That one can leave us with 169 people where they for the treatment centers, active cases, that is. Number 5 now Plateau State with 2,071 confirmed cases of COVID-19. And inside Plateau State, 1,059 people still they collect treatment because 29 people already don't die, while 983 people now the ones where don't recover and they discharge them, they go their house. Glory to God Almighty for their case. All right, so we come to say the total number of tests where they don't conduct inside Nigeria as of today now 369,904. 369904 369,904 samples where they don't test for inside Nigeria. And the positive cases for Nigeria now, they clock 50,964. So we don't pass that magical 50,000 mark. In fact, they approach 51,000 already. All right. And all the 36 states and, of course, the FCT don't already get confirmed cases. While for Nigeria, totally, we don't discharge 37,569, and that one include the 265 people where they discharged yesterday. And of course, the total number of people who don't die from COVID-19 for Nigeria now 992, just 8 short of 1,000 people where COVID-19 don't kill for Nigeria. Well, slightly the death rate for Nigeria don't reduce to 1.9%. Before it been there exactly at about 2.2%, but it's now down to 1.9%. And the NCDC they talk, let's say that they push to make sure say we record less than 1% fatalities. That is, the people who go die from COVID-19 make it day less than 1%. But of course, if we check the people who don't get COVID-19 for Nigeria, we go see say now men they carry the lion's share of 64,000. That is 32,622 men like me. Now they outnumber the women almost by twice with 64%, and then the females now 18,342. And the people will be saying now them this disease they catch more than any other people. They constitute 25% of the total number. That is 1/4, 1 into 4. Now, the people with their age, they between 31 and 40 years. And you're going to see this one at the vibrant population, those people where they do strong thing inside the country. Yes. So 25% of, and that one are people where they between the ages of 31 to 40. All right. All right, now so we go leave the matter for inside Nigeria. So make we go chook eye for how COVID-19, the numbers don't tally for inside the world. And make we start from inside Africa, where Ghana, day number 5, with 43,325 confirmed cases, and number of people who don't die inside Ghana from COVID-19 now 261 people. Morocco, day number 4, with 49,247. That one now because they find additional 1,609 people today. And like I talked yesterday, another 3 days with the way Morocco they go, which is heartbreaking really, they go fit overtake Nigeria. If they score like this again by tomorrow, they go definitely overtake Nigeria to become number 3 in Africa, and that one go mean say Nigeria go drop to number 3 where they now. All right, and the people who don't die for inside Morocco from COVID-19 are 817. So we jump Nigeria with the number 3 to number 2, where Egypt they with 97,025 confirmed cases of COVID-19, out of which 5,212 people don't lose their lives. Number 1 inside Africa, we now them also be number 5 for the world now. South Africa, we don't get almost now just 60. South Africa go hit 600,000 confirmed cases. So now 599,940 confirmed cases we get for South Africa. Out of that number, 12,618 people are the ones who don't lose their lives. So totally inside Africa, we don't record 1,167,797 cases of COVID-19, and since today start reach this moment, we don't record 5,405 new cases of COVID-19 for Africa. The total number of people who don't die inside Africa now 27,112. That one additional 90 people who don't die since today for Africa. The people who don't recover inside Africa, thankfully, now 887,496 people. And they can't leave behind 253,189 people who still collect treatment for inside Africa. And out of these people will still be the active cases, 1,201 people are the ones where they inside the serious or critical conditions. So we come back to the world now, and we enter number 4, where Russia, they ahead of South Africa with 946,976 confirmed cases of COVID-19, out of which 16,189 people don't lose their lives. India, day number 3 with 2,973,317 confirmed cases. So very small, make India enter 3 million. And the people who don't die for India now 55,928 people. Brazil still there number 2 with 3,513,039, and out of that number 112,670 people don't die. So the USA still they far ahead of everybody. They slowly gradually approach 6 million, as they don't get 5,770,786 people. And the people who don't die for inside USA from COVID-19 now 177,890. All right, so for the total numbers inside the world today, we don't record 23,020,429 total cases of COVID-19, and the new cases since today now 170,327, and almost 800,000 people don't die, as we don't count 799,848 people who don't lose their lives to COVID-19. That one 3,472 since today begin, and we still they count. But the good news, we say 15,632,608 people don't recover from COVID-19, and that one can leave us with 6,587,973 people who still they battle the disease for inside the world. Among them, the ones where they in serious or critical condition are 61,810. So if we do per 1 million people inside the world, 2,953, almost 3,000 people don't test positive to COVID-19, while the ones who don't die from COVID-19 out of every 1 million people in the world now 103. All right, so those are the total figures, and if we put eye on top the new cases from yesterday, the figures they show us say yesterday will be the 20th of August, 267,000 people, all right, been died from COVID-19. 267,532, where they slightly lower than the numbers when we record on the 19th of August. That is the day before, and that one 272,000. Okay, and let me see the small figure way there on top. 272,098 people away been get COVID-19 yesterday. So there's a slight drop between yesterday and day before yesterday, but it's still day high because it's still they approach the 300,000 mark. When we they pray say it go they come down. So if you did look at this curve both ways, new cases, new deaths is still zigzagging. It never really flatten. It's still they approach the highest. They go up in terms of the new cases. Well, yesterday the number of people who died from COVID-19 inside the world now 6,182. Okay, 6,182 people been died yesterday from COVID-19. Will be slight reduction from the day before, will be the 19th of August. All right, okay, let me see. 19th of August will be in record. Okay, let me see, 6,668. All right, so about 500 difference between 19th and yesterday will be 20. All right, so for Nigeria, our percentage in terms of mortality rate don't reduce, but for the world it's still the same thing. The death rate from COVID-19 still be 5%, and the recovery rate still be 95%. And for the people who are in serious or critical condition now 1%, and then of course those with their symptoms they mild or they don't get symptoms at all now 99%. All right, this figure is what I tell you now. As we don't they talk, if you don't they change, because more and more reports are coming in real time from different parts of the world. But at least with this one you go get clear picture of where we dey on top COVID-19 infections for the world. All right, so make I go collect some messages for all of us. Come back, and when we come back, we'll go begin Vano with the gentleman we come meet us from Connected Development, aka Code. So anywhere where you dey, whether you watch, you dey listen, or you dey follow us for social media, anyhow, anywhere, just turn down where you dey, because now we go come back. We no go take.
This is a special announcement for Abuja residents. Coronavirus is real and it's killing many in Europe and Asian countries. COVID-19 can affect all of mankind, irrespective of your tribe, religion, skin color, rich or poor. Currently, there is no vaccine to prevent coronavirus, but preventive measures of washing the hand, staying at home, avoiding gatherings will curb its spread. If you develop emergency signs of severe fever, cough, and shortness of breath, isolate yourself and call 112 or call National Center for Disease Control (NCDC) on 0800 9700 0010. Clean and disinfect your environment frequently and avoid cold drinks.
kéré o. Látàrí ìmọ̀ràn àti ìtọ́ni tó ti dọ̀dọ̀ àwọn akọ́ṣẹ́mọṣẹ́ oníṣègùn òyìnbó jáde, ikọ̀ tíjọba àpapọ̀ gbé kalẹ̀ láti kojú páńkó sí ìtànkálẹ̀ àrùn coronavirus COVID-19 tó ràn káàkiri tó fi mọ́ àbájáde ìpàdé ìgbìmọ̀ ètò ọrọ̀ ajé ìṣàkóso lílulẹ̀ wa FCT ṣe ìpàdé papọ̀ pẹ̀lú àwọn olórí ẹ̀sìn gbogbo tí wọ́n sì fẹnukò lórí àwọn ìgbésẹ̀ wọ̀nyí. Gbogbo olórí ẹ̀sìn àti olùjọ́sìn náà lárọ̀ láti tẹ̀lé gbogbo ìlànà ètò ìlera gẹ́gẹ́ bó ṣe wà níbàámu pẹ̀lú àwọn ìtọ́ni àti ìkìlọ̀ àwọn elétò ìlera fún dídẹ́kun àrùn coronavirus. Fún díẹ̀ yìí, àpéjọpọ̀ ilé ìjọsìn kò gbọ́dọ̀ ju èèyàn 50 lọ lẹ́ẹ̀kan ṣoṣo láti sísìnyí lọ. Ẹ̀wẹ̀, àpéjọpọ̀ bíi ibi ìgbafẹ́, ilé ọtí, àpéjọ alẹ́, ibi ètò gbogbo, gbọ̀ngàn, yàrá ìwò bọ́ọ̀lù àtàwọn míì lòfin ti dè báyìí ná títí di ìgbà mìíràn tíjọba ó pinnu. Gbogbo àwọn ẹ̀ṣọ́ aláàbò ló ti wà digbí káàkiri láti bójútó àwọn ibi tá a ti mẹ́nubà náà láti bá jẹ́ pé àṣẹ náà múlẹ̀. Láríjà ìgbésẹ̀ yìí ni láti bá jẹ́ kí ó rọrùn fún ṣíṣe àwárí àwọn tí ó ti lùgbàdì àrùn yìí fún àwọn òṣìṣẹ́ ètò ìlera. A tún wá rọ gbogbo olùgbé ìlú Àbújá láti má ṣe fòyà kí ẹ sì rí dájú pé ẹ ń béèrè fún nǹkan tó bá rú yín lójú látọ̀dọ̀ ẹ̀ka ètò ìlera FCT àti àwọn lájọ̀lájọ̀ ìjọba mìíràn. A wá rọ gbogbo olùgbé FCT fún àgbọ́yé àti ìfọwọ́sowọ́pọ̀ tó dán mọ́rán láti rẹ́yìn àrùn coronavirus.
Site na ndụmọdụ na ntụziaka ndị ọrụ ahụike otu task force onyeisiala hibere na-ahụ maka mgbochi ọrịa agbụrụ ọhụrụ nke akpọrọ coronavirus maọbụ COVID-19 nakwa ihe si na nzukọ otu Economic Council pụta nke ha mere n'ụbọchị Tọzdee abalị 19 nke ọnwa Maachị afọ 2020. Ọchịchị Federal Capital Territory na ndị ndu ụlọ okpukperechi dị iche iche nwere nzukọ wee kwekọrịta na ndị ndu ụlọ okpukperechi na ndị na-abịa ekperechi ka ha dododo hụ na ha debere usoro niile ndị ọrụ ahụike wepụtara iji gbochie nje coronavirus ma kpesie ekpere ike maka nchekwa ụmụafọ Naịjirịa niile. Amachigidere ya n'iwu na ụlọ ekpere ọbụla agaghị akarị mmadụ 50 mgbe ọbụla dịka atụmatụ ndị amawapụtara iji gbochie nje coronavirus n'isi obodo anyị bụ FCT. Ọgbakọ niile na parks, garden, ụlọ oriri na nkwari ọbụla ebe a na-agbakọ na-ekiri egwuregwu bọọlụ nakwa ebe ndị ọzọ ka emechiri. Agwala ndị nchekwa ala anyị ka ha na-agagharị ịhụ na edebere iwu a. Isi sekpụ ntị eji tinye iwu ndị a bụ ka e nwee ike mee ka ịchọpụta ndị a tụrụ anya na ha bụ nje a dị mfe. Ndị ji isi obodo anyị mere ebe obibi ka a gwara ka ha ghara iji ụjọ ego ihe kama ka ha nwee ezi nghọta gbasatara nje a site na ngalaba ọrụ ahụike FCT nakwa ụlọ ọrụ gọọmenti ndị ọzọ na-ahụ maka nke a. Anyị ji ohere a akpọku ndị ji isi obodo anyị mere ebe obibi ka ha biko kwado anyị n'atụmatụ a iji chụọ nje coronavirus ọsọ ukwu eru ala. Ọ bụ Malam Abubakar Sani tinyere aka n'ozi a.
Magbajaje FCT ayinashi ayo coronavirus ayo pabanto kwen ko lolo agnge kuku azawu in Europe nchere bode Asia yi coronavirus kota kphelege ho jigbajin ange coronavirus ekwen koto shigbe lolo onje shigbe ko lolo okone jinge la nana pi la hejia an aban azayeji ange haje za nya san ko hala kunya san bwa ba mi hayi onwe kwen gbain ngwamba ko hayi nje NCDC onwe kwen tolo nywe mo tolo chiwa gbain tolo gbain tolo.
Al'ummar Abuja da kewaye gafaran ku ga tunasarwa a gare ku game da annobar cutar corona da ke barazana ga rayukan dubban ku. Corona gaskiya ce a kuka rudu da wajiyojiyo za ta ci ku ta karku. Ko London ta kashe su Robin Victoria, Roma ta kashe su Faltini. Cuta ce da ba ruwanta da ɗako bawa samu da rashi baya yi mata cikas. Corona ba ruwanta da bambancin kabila ko addini. Mu sani corona ba ta da magani amma tana da rigakafin da ya fi maganin saukin samu. Muna ba a wanke hannu a duk minti, kauracewa cunkoso da tarika da babu lalura, wanka wanki da gun zama mai kyawu. Corona ba ta da babban maki'iwa mai tsafta. Mu takaita zirga-zirga da babu dalili, kai mai dalilin ma mu bari mu samu rabauta. Da kaji mashashara da ba ta da saiti, tari sarkafewa makogaro da zafin haɗiya, majina ruwa haɗa da kasala, atini zawo da lumfashi da ƙyar a jikinka. Marmaza latsa 112 lambar nan ta emergency. Ko kai tsaye ka kiranyi cibiyar kiyaye yaduwar cutuka ta ƙasa a lambar oyansu ta 0800 97 00 00 ka ba su cikakken adireshin inda za su tada kai za su zo ka haƙƙwar gida ba fashi. Guji muguwar aniyar tun da na kamu sai kowa ya kama, Allah da ya cuta shi ke yayewa da kare bayansa. Kai dai keɓance kanka na kwanakin da aka ɗaya ba da tsafta a dujiki da gidanka, guji kayayyakin sanyi su askirin da soɓo soda, guji tattaba abubuwa barkatai da babu dalili. Corona ma kira ta kallabe har a tebur ɗinka. Ku tuna rigakafin corona ya fi maganin ta saukin samu. Allah ya yi mana tsari da baƙuwar da ba ta da kunya.
This one na ogbonge informate for all man pikin wey tanda for obodo Abuja. Coronavirus no be lie. As e be now, e don kpai plenty people wey dey for obodo Europe and Asia. COVID-19, e no want to know who you be. Your tribe abi na your religion. Your skin abi na your color. You rich abi you poor. As e be now, this thing wey dey call coronavirus, e no get medicine at all o. But e get plenty things wey you go do in order for this thing not to catch you. Wash your hand, tanda for your house, avoid the place where people plenty or shaking of hand, so that you no go dey waka dey increase dey go. If you can't get the signs have been a symptom where the thing they show you, like a severe fever, cough, you know they breathe well, make you isolate yourself, or you call NCDC 080-97000010 or emergency number 112. Clean your environment every now and then and avoid anything way cold. Cuff your chick.
All right, we don't come back on top COVID-19 citizens feedback, and the station still remains Human Rights Radio and Television. If you dare for inside the FCT or any of the cities or states where they are around, if it catch us on top 101.1 FM. And if you dare for inside Nigeria, try and make you watch us on Top Star Times channel 126 for the DTT or terrestrial platform. But if you dare for Africa, anywhere where Star Times they work, make you find us for channel 537 for the DTH or satellite platform. And then find us for social media where we transmit live for Facebook and YouTube. The name now Human Rights Radio TV. For the Facebook page, make you follow them, and of course for the YouTube page, make you just the YouTube channel, make you subscribe, and for the two of them, make you click the notification button so that anytime when we do something, you self go know and you go follow us. If you want follow us, or if you want watch or listen for our mobile apps, make you look for the Human Rights Radio TV app for inside both the Android Play Store and the Apple iOS App Store. Okay, find this app there, download it, is free to download and also to use. And then also you fit find for these two app stores, our other app will be Brekete Connect. Now Brekete Connect now the app where you go fit use watch or listen, and also you go create account, then begin to socialize and share media for there. And on top the Human Rights Radio TV app, fit also follow our other stations, radio and TV stations, anywhere else where they for the world, including Brekete Family Radio 99.9 FM Kaduna. Only God is 100%. All right. So these are the ways where you fit follow us. Of course, unless you dare anywhere else in the world, where you fit also look for us for the streaming apps and websites around you. Just use our names, find us, you go see us, and you go the day with us 24/7 on top waiting with they do there. All right, as I don't talk that one finish, make I welcome my guest this night, the person where me and I'm go follow over not together this night. We come from Connected Development, aka Code. In name na Titus Yakubu. Titus Yakubu come from their visuals, right?
Yeah, data visuals.
Data visuals, thank you. Now them they collect data, create visuals to take educate the public. And the contact say, make it not be like say that they always talk about money. Their interest now only about how they spend money. But the human beings where they spend this money on top, how far with them, the contact say, okay, make Oga Titus come tight us with better information on top issue of COVID-19. If they do what they call risk communication, all right? Make they tell us the risks and everything will concern COVID-19. Oga Titus, I tightly welcome you to us this evening.
Good evening, thank you.
All right, so we talk COVID-19, and one thing where I know say you self go don't follow us notice, we say many people know they believe say COVID-19 they real. If you ask them, they go say nah lie. Say now waiting government just carry one come chop money that time, some people come to talk say, they want to pursue all of us inside with lockdown so that they go install 5G. Plenty things where they talk. I know say you go tell us about fake information and all of that, but now many people know they believe COVID-19 say it is real. So make you try help us talk to our people, make them understand what in this COVID-19 be and why they suppose believe say this thing is real and we suppose they careful with them.
Okay, thank you. I thank you very much. But before I start, I want to thank person who carry me come here now, Osiwa.
Okay.
Oxfam Nigeria. Now them carry me come here. Make I come talk. Waiting be this COVID-19. So I want make Nigeria know say this virus now something where we say if he enter you, it go make you say you no go feed they breathe well. Yeah, you go they feel say you want sleep. They get your body, they feel tired. Yes. So and this virus, you see, we dey track money. We dey track government say they come out money, they give palliatives for citizens during the lockdown. Where we say plenty people no get money to buy food. So, but if you can't dey track this money and people no can know say waiting be this virus, they can't die. Who go they now?
Who they track the money for?
Yeah. So now wetin make say I want come talk. Make them know say this virus dey real. They say it no be saying something where you go see, but it get where we say you fit do where that the virus no go come close to you. Yeah. So the virus now something where we say it dey cause na coronavirus cause this COVID-19. So and this thing it dey enter body, they touch na lung and heart. This thing they touch. So I want this to come touch. Yeah, it go make you say you no go dey respirate well, you no go dey feel dey breathe well.
Okay, you dey talk the symptoms now, Abi?
Yeah, so you no go dey talk and you no go dey breathe well. And this virus we say no be death sentence o. No be say na death sentence.
It fit kill. It fit kill, but no be say na death sentence.
Yes. E get where we say if you do, the virus no go come close to you, e no go touch you. But if you no come follow wetin our medical people they talk say do, you no do, you go enter voicemail. Now you go first us go that place where we say So you get things where we say if you do, the virus no will come close to you. And number one thing we say, if you come out, they wear your face mask. And that face mask, no be say na only face mask go stop you from getting the virus. If you wear your face mask, make sure say the next person where they close to you, you get 1 meter. No, they go close to people. Because if you go close to people and the person will get that thing can't talk and saliva can't touch you, you can't breathe them, no problem. And that one you go they cause another thing for you. So they wear your masks, they keep distance with people. And after if you do that one, if you come back, you want to enter your house, make sure say you wash your hand well. Get soap and wash your hand with water where they run. Be saying that tap water you go take use, wash your hand. So as you on them, they wash your hand like 20 seconds.
Okay.
Yeah. So but if that water no come dey, we say another thing dey where we say you go rub am for your hand. That's why they say if you use sanitizer, this hand sanitizer, you go just rub am for your hand until the thing dry. So that one too.
It go still help clean your hand, even if you don't see water and soap.
Yes, yes. And another one be say, make sure say you avoid people where they sick. So if person they sick, no they too go close to am. No they too go close to person where they sick, because you don't know whether that person get that thing. You don't know whether that person na corona na COVID-19 or na just normal.
And even if the person you get them, you can't give the person, you go worsen your situation.
Yes. And you see sometimes why did they say make we know they go close to people? We say even person will get them. Some people get them, but the symptoms go dey mild. You know go show. Yeah, na small the thing go come they start before you go know say, oh, so this person gets the virus. So that's why they say prevention is better than cure. So they always prevent yourself. And another one we say, disinfect your surroundings, because if person wey get am now come talk and his saliva come, a droplet come drop on top your table or your door or so e go dey there for some small time before the thing go come, the power go come
reduce or disappear.
Yes. So that's why they say they disinfect your surroundings and make sure say you keep yourself physical fit. They do exercise small to just make your body dey well, your system, make your body system they work very, very well.
Okay.
Yes.
All right. So now the symptoms now are way you don't read out for us. But like you know, now we be data people, because now data now they check facts, cross-check facts, and all these things. We don't they talk and say some people they talk fake things where no be true. Some now deliberately they want mislead and deceive other people. Others now mistake they make. Now they just maybe misunderstand something. Can't they talk the one when no be? So I don't know whether he gets some of these mistakes, errors, and things where the people know they really understand well, so that you go help us know the one will be real, the one will not be fake. Especially most of those common errors, those mistakes where people they think misunderstand how this thing be.
Okay, you see, when COVID-19 starts for Nigeria, so now during the lockdown now, so some people come they talk, say all this side talk, they say if you take water with salt, say you go kill corona. Say if you take chloroquine, say you go kill corona. If you use antibiotics, say you go kill corona. And all this one are things we say, you know they do anything for COVID-19.
At least scientists never confirm
they
say they work.
Say you get medicine, this thing get cure.
Some people come they talk ginger, garlic, all those things.
You know they work, all those things now wash. They want just make people kill. You know, if you remember when Ebola starts, they say if you bath with salt. say you go kill Ebola. All this one not be something maybe say scientists don't prove and say they work. Now just people now, some people want just mislead others. So all these things where you see say I talk now fake news. Say if you drink lemon, hot water, say it go work for you. Now for where that one no they work, nothing. They never prove. The scientists never talk. Say that thing get.
It they work.
Yes, you know they work. Say if you spray Dettol for your body, say it go work. Yes. Say if you use special oil, all this anointing oil, they say it go work. Say palm water. Now all this talk, they know they do anything. All these things where people they talk, they know they do anything. Now wetin make say NCDC say all this if you want make you dey safe, if you no get anything to do, if your Maggi or salt no finish for house, no come out say you want go outside go do anything. Dey jeje inside your house, sit down, no dey too enter people. Even if you go enter people, make sure say you keep distance, keep space.
When you talk enter people, that is to interact closely with people.
No, they do all those things. Make sure they say that you get distance with other person.
Okay.
So narrating all these facts about COVID-19, you know they work. You never get cure.
All right. Now, as this COVID-19 matter done day now, many Nigerians they talk say they never use eye see. Say they never know anybody will get this COVID-19. So how it go be say a day and they never know. This kind of people they talk like this, waiting be the thing where you go tell them as reaction so that they go understand waiting the mistake what they do to they think like that.
You see, this is now something where we say, if to say now only Nigeria, we go talk say na true. But now something where it affect the world. Because why people no go believe for Nigeria say our country, you know, they balance well. Now everything make say anything where they go talk, people no go believe them. No any data, we no get data where we say if people see, they go no say yes, this one na true, say COVID-19 day. But people they die. Waiting people want know say waiting they want make make them know say COVID-19 dey. They want see picture say okay this person die, because even when Abba Kyari die, people no see say believe say na that thing kill am. They know so they want see picture. They want make government come talk say so person die, because every day na number they just dey see dey increase, but they never see picture of people for TV or for newspaper say okay na so person na dem die yesterday for COVID-19 no. So they wan see say they provide them with data, make them see say this thing na true e dey. Yes. But
you support say okay if Mr. A die, we will come say okay see Mr. A for here, see him picture, see this, see that. Make we just convince people we no believe say okay yes COVID-19 dey real. You know
if to say Abba Kyari no die for this thing, people no go know say that thing true dey exist. But as him die, some people believe say e dey true. But even if na for one day, make them just talk say okay see wetin dey happen o. People go believe am. Because I travel go house village. This thing where we dey do for these cities, for village they think say they talk say the COVID-19 na for rich people and na for city dey o. Yeah, you know say you know dey Abuja, you know dey village na for Abuja, Lagos na there the thing dey. They enter church no mask, no soap, water no even dey outside church. So the thing they make people for village they talk say the thing if for one day they just share okay see wetin dey happen, that one go even put small sense for their head. They go know say that thing na true. But if every day go they bring number they give people, they bring number they give them, they no go believe you. Some people believe say na seeing say na im be belief o. Say when they see with eyes they go believe. But when the people dey house during lockdown, plenty people just talk say government wan punish them. Say nothing dey like that. Because them they no get food to eat. They no get money, they just sit down for house. So now wetin make them know they believe say that thing dey real.
Now, but okay, now government don dey gradually open up the whole space. They allow more and more sectors to open. Now they don't allow secondary schools, the exit classes, that is SS3 and JS3, to start to take their exams. Already the SS3 students don't they take WAEC. And now the JSS3 students go take their own later. Then the common entrance both to national and state schools. But the tertiary institution students, they never really begin the talk when they go open, and already they don't go do protest for it. I think that was the first day where they go do protest for inside the FCT. They go different places, Unity Fountain, go Ministry of Education, say I make the open school for them, say it don't too much. Now, for schools where they open, if you go talk to them specifically about inside school, how they go behave themselves so that this virus they go really escape them. Waiting be that thing where you go tell them, especially now where some schools don't start and others don't they prepare their mind till they go start.
Okay, for you see student where they now they write WAEC.
Yeah.
The instructions, the guidelines where NCDC and World Health Organization give now to just obey. If you do waiting they say may you do, they wash your hand, they keep distance, wear your face mask, no they too touch things. If you see person where they sick, no go close to them. Even if you go close to them, make sure say you cover your nose, you cover your mouth with your face mask. So and after if you do that one, before you touch anything, you make sure say you wash your hand. Make sure say you sanitize your hand. So that thing no go come touch you. Because na very dangerous virus where you never get cure. Maybe say if you do you now, they go say they will carry you, go give you injection or give you some drugs to take, say you too go dey well. Yes, because as this afternoon I dey read one news, they say 7 students for Gombe when they write WAEC, they don't get the virus.
Yes.
So you see now people wey don dey that place now, they go dey very careful and so wetin students suppose do now, wey if they want be safe, now to just obey the rules.
All those protocols.
Yeah, all those protocols. Just obey everything. Now I think will make you safe be that.
All right, make it no be like say you come talk finish and come talk about the organization where they represent. All right, make you tell us small about Code. Tell us about your organization, the work we una done they do, and since we una start, and then the one we una they do now on top COVID-19 for inside Nigeria. And I hear say una dey for other countries outside Nigeria. How many countries?
We dey Cameroon, we dey Gambia, we dey Kenya. Yeah, so
that's like I think about 5 or 6 countries.
We dey Cameroon, we dey Kenya, we dey Gambia, we dey Ghana, we dey Liberia.
Okay.
Yes.
Okay, but now only Nigeria and they do follow this COVID-19 money. I've been across all these places.
So for Gambia too, they follow.
Okay.
Yes, Gambia participated. They follow the COVID-19 money too there. For Cameroon too, they do. Even for Kenya, they do. Okay. Nigeria here too, we they do.
All right.
We they follow the money.
All right. So tell us more about Code and then about follow the money before we go allow you make you they go your own this night.
So you see, Connected Development. Now 2012 they fund them.
Okay.
So and the founder na Hamzat Lawal.
All right.
Yeah. So we they use this follow the money to track government money. Where we say they release money for project, and person where in hand long, he go collect the money, put for in pocket. You know go do waiting. He supposed to do for the people.
I like that. Yes. Person where in hand long.
Yes. So you go just collect. You know go do waiting. Government say waiting they supposed to do for that for people where they marginalized. So we will ensure say this money where government release. This money where they put for these people, they use them well. They do these people waiting they want.
What thing they supposed to do for them?
They supposed to do for them. Yes. So because they know if you just stay there, they go vote you go there, and at the end of the day, you no go do them. You no go give you no go do anything them they want. So if we go make sure say the money they utilize them, they use them well for waiting they put them say they go do them.
Okay.
And you see for 2012 we track money, we advocate for Shekira people.
So, who be Shekira people?
Na Niger State.
Oh, okay.
Na Niger State. So wetin happen that time na lead poison due to this illegal
mining. Okay.
Yeah. So the thing when they affect children, then they die. And that time, Ansat and colleagues, so we see say go better make children go just they die like that, and government they do anything. So we travel go that community, we go see say, because from waiting the chief talk say then they suspect say because banana plantation they close to that place, so they suspect say whether na witchcraft for that place they come they kill their children. Yes, so they don't know say na that thing
that lead poison.
Yeah, na him come they affect the children. So we come back, come they talk for Twitter, Facebook and all that. So before we know something, government can't respond. They can't go there. They send people go there, go check, say na that illegal mining when they do that lead poison, na him they affect their children. So before you know something, government release money. Now so they take to save those children where they there.
Okay.
Where we say they really disturb them. So now so they take to save them. And now again, so during this COVID-19 now, we want to make sure say this palliative where government say then they share, they reach the people.
We really need them.
Yes, they reach the people where really need that food items, that money. Because sometimes they go just they talk. I no say whether na true they do, no be true. And even now, say if you ask people go they talk, they wonder say they say that they share food, they give money. Them they know they see anything. So we want to make sure say that money
you reach where it's supposed to reach.
They reach where it's supposed to go.
All right. So I don't know whether you get any other thing where you want to tell us before we go begin the arrange Kaya come up from studio this night.
So I want also thank Oxfam Nigeria for supporting the program.
Okay.
Yeah, we thank them because now them make us come this place, come they educate Nigeria, make them know say something like COVID-19 they exist. So may they make sure say they adhere and they obey all the protocols.
Okay.
Then they go they safe.
All right, for people who want to reach connected development, how they go fit reach connected development, maybe to follow them and participate in what they do. So
we get platform where we say, we they call them I follow the money.
Okay.
So I follow the money.org. Okay. So if you want, if you sign on that platform, you go see what thing we they do, and for there you go talk waiting they happen for your own community. Okay. So if you talk and for there, and we verify the talk, say now true, then we go now help Chukan. They talk, see they make sure say that thing.
How people fit connect to this platform?
Yeah. So if they want to connect to the platform, they go log into ifollowthemoney.org for their browser.
Website.
Yeah, they go type ifollowthemoney.org, ifollowthemoney.org.
Okay.
So now just simple, you go use your Facebook or your email, your Gmail, and log in. Once you do that, you go there, and our office there for central area. So if you want talk anything, you go put on for that I follow the money platform.
Okay, but for people who want to follow for social media, where the handles they go follow?
The handles they for Twitter now follow the money, follow now normal D alphabet, not
okay D.
Yeah.
Follow D money. Okay.
Yes, for
one is normal money spelling.
Yeah, normal money spelling.
Okay.
And for Facebook now follow the money. Follow the money. Yeah. So
follow the money, normal spelling.
Yeah, yes, normal spelling. Right. Yes. For Instagram, now follow the money. Follow the money.
The money.
Yeah, the money for Instagram. For and connected development for Facebook, now connected development.
All right.
Yes. And for Twitter, connected_development.
Connected_development.
Yes. Okay. Now there, if you want to follow us, you go. If you type and you go get us.
All right. Make we thank you very much, Mr. Titus Yakubu. At least you don't come Titus with some better information this night, and I want to make you carry our greetings. Go back to Connected Development and all the better people where they sponsor Una. Make sure say Una come here, come reach us, and hopefully another time when it is necessary, you go fit come join us. Thank you, Titus.
Thank you very much.
All right, not go anywhere, just stand there where you did, because COVID-19 citizens feedback go continue now after these messages where they carry come meet you. Will they come back now? We no go tell.
bandiraɓe fulɓe andon fa komai sai hejam captain komai fulɓe futa gonɗon nder abuja gonɗon ko toye gonɗon nder nigeria andon allah salliti nyau ko ɓe gi'ata coronavirus ɗum anda debbo balle gorko bandiraɓe loten juuɗe takkitaɗen nder himɓe to en jehu kaɓɓal tegal joɗoɗen wuro andon coronavirus alamaji muɗum no wodi mura ko waddata yilɓe iɗum ɗeɗɗa dane iɗum wadda doggure he turre to a nani alamaji majjum nodda lamba go'o ɗiɗi ko emergency no wodi ko noddoton tubako dow lamba 0800-777-0 ko noddon hoynane jeetati hoynane jeenayi jeeɗiɗi hoynane tatoy he go'o he gotel kokkaɓe adreshi maɗa ɓe garan fawuro ɓe gaddane faaba bandiraɓe fulɓe kakkile ɗen allah hinnu en nyaw bongo amin summa amin.
If no sanitizer, say na soap I go use, oh. Na soap I go use, oh. Na soap I go use, oh. COVID-19. Make you wash your hand, oh. COVID-19. This thing they kill, oh. COVID-19. Make you wash your hand, oh. COVID-19.
Avoid touching your eyes, nose and mouth with unwashed hands. Avoid touching your eyes, nose and mouth with unwashed hands.
Latana J, you could finapi, Inapwa, and sanitizer, ego, in Chokwe, Italashi Basi, Iawaya Sai is a do, Yai, but I ain't quaint, Tolo, you might want Tolo, want no, my wamba, my number, my Tolo, bye, Tolo, Chuak, my Tolo. nwata nwamba mai tolo nwamba mutnai nwata nwamba.
Get all the information you need and your concerns attended to by calling the FCTA toll-free lines at Tisalat on 0809 993 6312, 0809 993 6313, MTN 0803 123 0330, 3CX 0708 063 1500, WhatsApp 0704 212 8340. You can be part of the continuous conversation by downloading the FCT Response app from Google Play Store and iOS. Totally free. FCTA Call Center. It's all about you.
If no sanitizers in a soap, I go use oh. Na soap I go use oh. Na soap I go use oh. COVID-19, COVID-19, COVID-19. Make you wash your hand oh. COVID-19, COVID-19, COVID-19. This thing they kill oh. COVID-19, COVID-19, COVID-19. Make you wash your hand oh. COVID-19, COVID-19, COVID-19.
Avoid touching your eyes, nose and mouth with unwashed hands. Avoid touching your eyes, nose and mouth with unwashed hands.
Please maintain social distance. Stay at home. Use sanitizer or soap. No self-medication. Report any suspected case to FCT Emergency Operations Center. Call 081-099-01599 or 080-3132-0330.
Cuff your chick.
All right, I welcome us back for COVID-19 Citizens Feedback on Top Human Rights Radio and Television. All right, we've been get Mr. Titus Yakubu. We come meet us from Connected Development Code. I come talk to us about risk communication on top this matter of COVID-19 where they around us. All right, they talk about money, but they say, okay, maybe they even talk about the human beings where they fight for their money first. All right, we thank them. Next week, Friday, they go come back and we will still talk more with Connected Development. But right now, and a time when I go begin the give you all the latest news and information where we carry, come meet you on top of the center table for COVID-19 this evening. Okay, we start for inside the WHO for the headquarters where they for Geneva inside Switzerland, where they don't tell us say they talk this one today say the world will go see the end of COVID-19 in less than 2 years, and that one go day faster than the time where it take make that other pandemic way happen in 1918, what they call the Spanish flu, and that it could last less than that one take disappear. The person where they tell us this one, the Director General of the WHO will be Tedros Adhanom Ghebreyesus when he been they talk with reporters for inside their headquarters, where they for inside Geneva. Now I can't talk say as matter day back then, we get disadvantage now because we don't get what they call globalization. That one where they talk say we don't become global village. All of us they interconnected, and we don't they close and connected in different ways would make this virus come spread around the world like lightning. All right, but I can't talk say yes that one deal. But even now, the world don't get better knowledge and technology. So as they use the current tools where we get now, if we use them to the maximum, we go even create more things faster than that time, like vaccines and other things. Then we go take and fight COVID-19 faster than the Spanish flu take happen. But of course, that Spanish flu, now they talk to be the deadliest pandemic as far as the modern world, their history, they concerned, because it killed like 50 million people around the world. and the thing come affect about 500 million people. So like 10% of the people we affect being die. All right. And this number will be 50 million now times 5 of the number of people who died during the First World War. Okay, and the first victim of this Spanish flu, they've been recorded for inside the United States before the thing come waka enter Europe, and from there around the world. And you know, say they don't talk say this our COVID-19 now, we did second wave, some people first wave, some countries don't experience second wave. And that way we say, okay, you go come, it go be like say you don't go, then it go come back again. So for the Spanish flu, the talk say it come in 3 waves. Come the first one, do like say it go, come back the second time. That one, nine be the deadliest one. Wipe more people before the third one, and then he come disappear. Well, the person will explain this one to us now. The emergencies, the head of emergencies for the WHO will be Michael Ryan. I can't talk say after that one happen, the virus will bring that pandemic. All right, they far deadly than they come evolve like come. Become one virus where they deadly past the normal, you know, say once the cold season reach, we go the common flu. Say that one, you just metamorphose to another thing where deadly pass like that one. But you can't talk say, but we will still be careful because this particular COVID-19 virus no they display any kind of wave pattern. So as far as this disease they now, the way that they see them, if you don't control them, it go just jump up immediately, like say you dey hold them hand, come out hand, and they jump up. So we need to be careful because this particular vaccine, no, they behave like the other ones. And this particular virus, no, they behave like the other ones where they see. Well, anyway, Russia don't tell us yesterday, say they will begin the clinical trials of that their COVID-19 vaccine, what they call Sputnik 5. And this virus, this vaccine clinical trials go involve tens of thousands of people, so plenty people, all right, where they go use test them. In fact, they look at about even more than 40,000 people, all right, now waiting. The Sovereign World Fund and the people where they back, they tell us about this Sputnik 5 vaccine trial. Where did they do? And the contact say this test, what did they do now? This clinical test, is they equivalent to phase 3 trials where the other vaccines don't they undergo. All right, Kirill Dmitriev will be the head of the Russian Direct Investment Fund. Conducted one online briefing say the vaccination where they go start with people where they at risk, where include medical personnel, go start next week. But now for people who carry the hands talk say, oh yeah, me and one make I join for the test. Of course, more than 20 countries don't book for more than 1 billion doses of this vaccine. And the contact say Russia already don't get agreement with plenty countries to mass produce the vaccines and supply them. And Russia don't talk say by October they go begin they manufacture the vaccine and begin to send the first set will go abroad by November or December. Okay, all right. For the vaccine inside Russia. But anyway, we come back for Nigeria as we still talk about vaccine trial. The PTF don't talk say those trials what did they do for COVID-19 vaccines, say they go start to do some inside 22 sites where go they across 13 states of Nigeria. The coordinator of the PTF will be Sani Aliyu. Been they talk this one during that PTF briefing where they do yesterday, but he no come call the name of the states or the particular sites where they go locate them. But he explain say they don't get all the necessary regulatory approvals to do those clinical trials for Nigeria, because Nigeria don't already register for waiting WHO they call solidarity trials where they do for multiple countries so that they go use them check across board how far these drugs dey, and of course compare their effects to such other drugs like remdesivir, interferon beta, and monoclonal antibody. And so this one now to make sure say we get the best cure, the best drugs to cure COVID-19. All right, and in talk say NAFDAC and the National Health Research Ethics Committee already done talk say make the carry go, and so very very soon they go start these trials. Well, anyway, the National Center for Disease Control (NCDC) and National Institute of Pharmaceutical Research and Development, along with NAFDAC, the Nigerian Institute of Medical Research, and other tertiary institutions already done they involved as they pursue research according to their mandates, also to find how far with COVID-19. Okay, all right. I make we hope say even among our Nigerians, we go our own effort locally, we go get something inside. Well, anyway, the Minister for Health, will be Osage Hanire, come they talk for the same briefing. Talk say so far we don't test 366,244 people as at the time when been a talk yesterday, and talks among those people we don't test positive. Now the people will be men. Now we high pass. And most of the people will get this infection, they below 50 years. And meanwhile, the people where they older than that 50 years, now them they die more. And then the people will get vulnerable health, now them they die more from this virus. Well, the minister contact say as for the vaccine, where plenty countries done the book, and many Nigerians don't ask questions, say other countries done the book. How far with us, Abi? We just sit down, they look. Well, the Minister for Health, come they talk, say Nigeria already don't key in through the WHO and other research organizations, so that by the time the vaccines where they work go come out, out of about 2 billion doses where they go gather together, Nigeria go get their share from inside these 2 billion doses. All right, the minister talks to this one through the effort when they make, as Nigeria already done join them for that thing what they call ACT, Access to COVID-19 Tools Accelerator, will be that effort what they make to coordinate the cure for COVID-19 or to find vaccine. And also it talks say Nigeria get interest for one facility where they call COVAX, where they support them with the funding, international funding, to get the buy the vaccines and also make sure say it reach across the whole world where they need them as soon as possible. So both for this COVAX facility and then the other one for the 2 billion doses where they go share to different countries, Nigeria just any side where it come from, we go collect our own. But of course, I still hope say our people locally go find our own where we self go begin. They tell people from across the world, I make una put on our own order. Well, anyway, the chairman of the PTF and secretary to the government of the Federation, Boss Mustafa, don't talk say the kind nyama attitude where Nigerians they show towards testing and to they follow the protocols where they on ground to fight COVID-19. Say now be the biggest headache where with the experience now, where the PTF and the authorities for Nigeria they experience in this fight against COVID-19. I talk say this kind of behavior don't they show now where would they see plenty new numbers across different states like Plateau State now don't they lead unlike before. I can't talk say this morning we don't wake up to see say our confirmed cases don't pass 50,000 and we don't they nearly reach 1,000 people we don't die from COVID-19. In fact, it talks say 14 of the people will die from this COVID-19. Now, doctors will be say they fight to save lives, come lose their own in the process. And the contact say the best way when we will fit show them gratitude and respect be say make we they do those small things where they don't beg us to they do to avoid COVID-19. All right. So while listening to the talk for that same briefing, it talks say, well, even though Nigeria don't increase testing capacity, sample collection still dey very low. So we get the ability to test, but ya kukuma collect the sample, enter the lab, test, problem. He also talks say the number of local governments will be saying I then get the highest number of COVID-19. Before we dey talk saying 16, but now it don't increase to 20. And talk say most of them they dey for areas where they difficult to reach. Right? Before we dey talk 10, from 10 we enter 16. Now the PTF chairman they tell us say 20, and now they even talk remote villages. But the good news we say today we get the capacity to test 15,000 people daily. But waiting in the tell us now we say we dey get between 3,000 to 6,000 samples every day. And when we been start this COVID-19 fight for Nigeria, only 2 labs been fit test for COVID-19, but today we don't get 64. So we come to beg Nigeria and say, oh yeah, people, make una come out, make the test una. Say if you test, one person can't test, just know say 7 people no agree come out and say very big problem for us in this our country will be Nigeria. So I beg our people make we they come out. But one thing where the minister talk way come they make me they think when they ask them say, oh yeah, some students come they vex. I say minister, no, the secretary to the government of the federation. Okay, say they vex those tertiary institution students where they vex, they do demonstration for Abuja. I say what thing they do. In fact, I say very selfish, extremely selfish behavior where they put up, because they come, they flout all the protocols as they carry placards, they walk up and down, no social distancing, nothing. Contact say they irresponsible. And so now that kind of thing now they cause problem for inside the United States where they don't see their numbers, they increase. And they come they talk say make also we understand say the WHO don't already talk and say now young people, youth, now them they carry this virus, they spread them more. So make we just keep our selfish feelings aside and understand the reason why things be as it be. Well, anyway, as the briefing still they go on, the federal government don't tell us say the flights will go to come into Nigeria from abroad now. They go make sure say you no go pass 1,280 passengers where go they come in. All right, the person where they talk this one now the Minister for Aviation will be Hadi Sirika. Now Sirika talk say now these 1,280 passengers, they are the ones where they go allowed to land into 2 airports. One, the Murtala Muhammed International Airport where they for Lagos, and then the Nnamdi Azikiwe International Airport where they for Abuja. Now you can't talk say they go also ban countries where don't ban Nigerians from to the fly to their own, and even people will live for their own. All right. So if one country talks say they no go allow flights from Nigeria, we too will not go allow their own come unto do me I do you where they allowed on top international politics. In talk say well that one a decision where they go take, especially as it go affect the amount of money where international passengers go pay when they arrive Nigeria for tests. Well, the person will represent the minister for that briefing now Captain Musa Nuhu will be the Director General of the Nigeria Civil Aviation Authority, NCAA. Okay. Remember say the European Union been talk say Nigeria go there among some 54 countries where they no go allow make our citizens enter their own country. So Nigeria don't already fire back say EU make una no come. Okay, for Nigeria it is well. All right, we'll move on. The National Economic Council don't talk say 16 states already don't receive 100 million naira grant where the World Bank being give may they take cushion the effect of the COVID-19 lockdown for their states. Governor Abdullahi Sule will be the governor of Nasarawa State. Been they talk this one through virtual briefing with State House correspondents after they also do their virtual National Economic Council meeting where now the Vice President, Professor Yomi Oshibajo, been sit down on top the matter yesterday. All right, that the World Bank being proposed say, okay, they go give $1.5 billion to states as part of the economic stimulus where they go take cushion the impact of COVID-19. And Nasarawa State Governor come to talk say the council been receive the report from the ad hoc committee where they talk directly on their behalf with the PTF, and the contact say the report show say the what they call States Incident Action Plan. All right, they don't show them how all of these states perform all this while, and from there they come see say 35 states where the World Bank talk say make them do them. 22 been signed that agreement, the grant agreement will be GA, but now only 13 been returned them. All right, so he talks to the 22 states where signed the agreement. Na Ekiti, Gombe, Zamfara, Sokoto, Niger, Taraba, Oyo, Abia, Enugu, Plateau, Delta, Bauchi, Ebonyi, Kaduna, Kwara, Cross River, Imo, Yobe, Ondo, Osun, Nasarawa, and Benue State. But of these states, the 16 don't receive their own, and the states will now receive their own now. Na Ekiti, Gombe, Niger, Sokoto, Taraba, Abia, Enugu, Zamfara, Bauchi, Ebonyi, Kaduna, Kwara, Cross River, Imo, and Delta. So the contract say 5 states already don't enter queue to receive their own, and these states now Plateau, Yobe, Ondo, Benue, and Osun. But funny enough, the same man where they do the briefing, he talks in his own state, we never give account details where they go take send their money. Hey, okay. As we talk about states, the Nigerian Governors Forum don't talk say 32 states out of the 36 states for Nigeria don't get molecular laboratories where they test for COVID-19. The forum also talks say 29 states don't receive money from the Regional Disease Surveillance Systems Enhancement Program to strengthen the public health response to COVID-19. This one they inside the communique with the issue after their teleconference where they do on Wednesday, and the contact say testing now be the number one headache where they get among all the states. The chairman of the NGF will be Kayode Fayemi of Ekiti State. Contact say they don't discuss with the federal government through the Ministry of Education to see how they go raise collect money from money where they never used from Universal Basic Education Fund. All right, so they say that they wait make the Attorney General give them advice also on the waiver on counterpart funds for states now on top of that UBEF money. Okay, is that right though? Access to money, accounting of the money go reach one day. All right, the Plateau State government don't talk say the increase in the number of new cases of COVID-19 in their states no be magic, no be anything. Say now because they do more testing plus other things where they do to really find cases. Now the Commissioner for Information and Communication for Plateau State will be Dan Majang don't talk say they don't increase community testing for the disease, and now they don't get 3 testing centers where they for NVRI for VOM, then the Plateau State Specialist Hospital, and then the Jos University Teaching Hospital. So now the 3 hospitals now will get the capability to test for COVID-19 for inside the state. Now I can't talk say they get the highest testing rate for Nigeria as they don't test 23,000 samples so far, and the ones where they don't see their results now 21,015. All right, so with this increased capacity and more, and that's capacity to test, and of course going to aggressive search for their local governments and rural areas, they get more samples and they test and get more results, while they still wait for 2,301 samples where their results never come out. All right, so a good one. I hope say more states go day more aggressive like this, so that we go find cases and they kill this thing off before it go worse pass as we plan them. All right, from Plateau State, we enter inside Kaduna State, where the governor Malam Nasser El-Rufai don't lift the ban on daily prayers and services for inside places of worship. But talk say now on the condition, say the worshippers must to follow all the health protocols. The person where they tell us this one, now the special advisor to the governor on media and communications will be Muyiwa Adekeye inside the statement where he released, and talk say they take this decision based on the recommendation where the state COVID-19 task force don't give them. Okay, well, at least they go day happy for inside that state now, as matter be where they don't see more activities for the state. All right, for inside Abuja, the Medical and Dental Council of Nigeria and the police yesterday be arrest one man where they talk saying a fake medical doctor, where they call him name Charles George, and the man they 60 years. Now, what did this man do? I go tell you. They say this man come they treat COVID-19 patients for inside one room where you go rent for Block 1 Julius Berger Junior Staff Quarters, that place where they call Berger Camp inside Kubwa. And the police detectives from the office of the Commissioner of Police FCT and them lead this operation. Now, among the things where they've been see inside this fake clinic of this alleged fake doctor, now syringe where they use do abortion, then the one where they call kidney dish. The police contact say the police they know him, saying a regular customer for the FCDA police station and for Kubwa area command headquarters because of different things where in they do they all those mixed drug for meeting. And sometimes they try to get money by force from some of the people where they come patronize them, and they do this thing since 2016. The deputy registrar and head of the inspectorate department of the MDCN, will be Dr. Victor Benro, described this thing, say na major breakthrough, and say the IG intelligence team and them get intelligence where lead them to this thing, and they can't catch this man where they practice alternative medicine. He no get license from the MDCN and he no register. Nothing, he just they doing own anyhow where he they do. Even the FCDA private health facility registration agency talks say they no know the man and they no register him or give him permission to go ahead to treat people. And the police talks say they've been find some fake letterheads and threat SMS where they send to people about cure of COVID-19. Conde talk say the way this man they do in thing, they very unprofessional and they go they important. Say any person will know say he don't do mistake, enter this man clinic for the so-called treatment. Say may they quickly go seek medical attention because the thing where they see there, it is very dangerous to human health. That's what we're going to go see for inside Nigeria on top COVID-19 matter. But anyway, the time where you go join me, put mouth on top issues where we don't carry come table this night, don't reach. So make you call or send us message for inside WhatsApp. Make we hear you and know how matter be you for mind. Whether or not things where we don't talk about already, or you want talk to us about any other matter as you take touch your mind as far as it concerns COVID-19. You want to ask question, you want to give suggestion, fine. Remember what we always talk, say, make your contribution day positive. Make it be something that will help us build up together. All right, the number now is 081-8999-1011. Use them, send us message for WhatsApp, but no call the WhatsApp call. No call WhatsApp call. And then once you they call us for phone, immediately down the ring, waka come up from where your radio day if others follow the listen. If not, just off them totally. All right, somebody day my line. Make I know who they there. Hello.
Hello, Simple Maddox.
Yes, good evening, Ganahumi, and I'm Devano.
Devano is Vicky. We don't like plenty grammar from Kabusa.
Vicky, my sister, I they welcome you.
Thank you. Congratulations to me and the first caller.
Yeah, congrats. So I go give you one big job of Mkwacha.
I don't want that one.
Oh, sorry. Okay, continue. Don't worry.
I am a junior sister. I love money.
Okay, you want money, Abi? All right. It's
Money.
okay. Send me your ATM details, okay?
Can you imagine? 410.
All right, Vicky.
I beg, there is a rumor that is flying up and down. I want to know if it's true.
Okay.
Also, I think that school is going to resume fully September next month.
Which September? They never talk them. The people where he did their hand to talk them never talk them. So no believe them.
Because I don't I never hear it. It's just they were up and down. That's okay.
But you know say if that one go happen, let me go first tell you.
Oh wow.
No be true, my dear sister.
Yeah, my brother. Take care.
All right, thank you. Good night, Vicky. 08189991011. Remember again, if you send us message for WhatsApp, make sure say you put your name and where they send us the message from, so that we gonna know who we and I'm Devano. Hello.
Good evening, sir.
Yes, good evening, and who me and I'm Devano.
It's Ozigi voice, Ozigi, aka Double Lion.
Ozigi, all right, we hear you. Welcome.
Well done job, sir.
Thank you, my brother.
There are a lot of things I need to commend and to appreciate the government of this nation.
All right, we hear you. Go ahead.
God, our creator, but because of other people.
Just do them short.
Because I think on the area of vaccine, and I'm so happy that the hope of vaccine is here already.
Okay.
As for the vaccine, you understand, we are always saying passing through a clinical test is the next stage now.
Yes.
And that of Russia, that they are targeting about 40 million, 40,000 times. I'm so happy. And the preparation of Nigeria, our government, to get this thing, the eagerness, in fact, is sweet my belly well. You understand?
Yeah.
There is like COVID-19. Your days are the number for now.
Amen.
I'm so happy, honestly. I'm so happy. Because the evil that these pandemics have caused to the nation.
No be small thing, Jerry.
In fact, the issue will never forgive this COVID-19. You understand?
Yeah.
I'm happy on that aspect.
Yeah.
And this, our Honorable Minister of Health,
the
way he reacted on this students, this Acacia students, protest yesterday or within the week.
Yeah. Yesterday.
He no sweet Mandela at all. The word he used on them, he no sweet Mandela. How can he say that it's a selfish ambition? No. The guy said they are mature to control themselves. Despite that, truly, the reports on the COVID-19 victims so far is
now the people who did that age bracket still. Now them, they get this thing more than every other person.
Even though, but it's not the death sentences now.
Yes, but you know the problem, you know the problem, It be like you be syringe, where carry poison enter the body of person where he kill. Syringe no go die, but at the person where they give injection go die. So these people fit go get contact with people where they at risk, where they vulnerable. Those people now be the ones where go die, because the idea is to cut off the flow of this virus. Once they see human body where they live inside, the chance say it go affect others go still there. That's the logic. Nobody say whether it go kill you, where catch them or not.
Okay, I am listening. Permit me to say something.
Yeah, we hear you, Ozigi.
Even there is an additional measure that the federal government and even the private university owners can be put again. Look at what happened in some sports stadium overseas. Even at the entrance gate, that sanitizing, can I call it sanitizing site, or the kind of build up stage?
Okay, that's disinfection booth.
That's it, where everybody must pass through.
No, but you don't hear say some people don't already talk say that thing, they necessary. Some say even they safe.
We need it for every campus for our students. You understand? Where each of them will be tested, and if their temperature or wherever is not fit, will not be permitted to enter into the campus. And it will not be the blame of the government, but they will allow other students. Not all of them that are coming are carrier of this COVID-19.
That's true. Very true.
I don't know whether you understand what I'm saying.
I understand
it's
you.
Like a stadium. that, look, if you are a carrier or your temperature is high, from that gate, you have to go home and treat yourself before you can gain entrance. But allow some percentage students who are not the carrier, we are just saying it, who are not the carrier, to continue their study.
All right.
They should put such a measure at the entrance of the campus, each gate of the campus, so that our students will continue their education. But for the honorable minister to say it's a selfish ambition, no, you should withdraw that statement.
Okay.
It's their right to be educated and to continue on their education. We should apply a measure of managing this COVID-19 that we find ourselves how to manage it. And life goes on. We have succeeded in other aspects of life. Look at transportation. Look at hospitality. I think even in the midst of COVID-19 that is dying now, but we are still managing other normal activities. We are managing with COVID-19 and we are going ahead. They should consider them.
All right. I support you to make them consider them, but of course, not be me and you, they make the decisions.
Every measure, whatever, even additional measure, they can just put, build something, build a security type at the gate for them to pass through, and then screening them. That's a screening booth. They should just build it for each campus. And all the private universities, proprietors of, the university, they should just say, okay, build a screening booth for them.
Okay.
Whether inside campus, let him go and continue his education. All right. If you are not qualified from the gate, go to your father's house.
All right.
Thank you, sir.
All right, thank you very much.
I don't know whether what I've said so far I communicate.
So, you talk your mind, and the one way you talk, bad.
Thank you, sir. Good night.
All right, good night, Ozigi. Ozigi say, okay, government done the try, but that one way the minister for health talks, say the students, they selfish for that protest where they do, say, like them. May they consider them, put additional measures to protect them. Hello. Hello. Yes, good evening. Hello. Kelechi.
Yes.
Kelechi, where are you from?
From Lugbe.
All right, Kelechi, we hear you.
Please, I want to ask questions.
Okay.
The money that they are giving to states, that's the government. Is it money they give them, they sign to release numbers for COVID-19, or what?
You say, is it money they gave them for?
To release numbers for COVID-19 or what?
No, now to cushion the effects, to help their citizens, not be to find numbers, no.
Okay. And that's what I want to find out.
Okay.
Because the lockdown is taking out of hands. For some people are working in the school, not fun at all.
Okay.
It's working every year for people.
All right, I understand what you mean. All right. All right. The money now for the states who don't already put the other palliatives or tax relief and stuff, may they take fund those things, and now grant no be loan where they go pay back. Now the World Bank now them make that money available, but give some conditions where states go meet to be able to to get that money. Hello.
Hello. Good evening, Ogamadox.
Yes, sir. Good evening, Gidahumi and Amdevano.
Usman from Ogamadox.
Usman.
Yes, sir.
All right, Usman, we hear you.
In fact, Oga, I like that your guest is bring in, because that guest talk the truth about why people know they believe say COVID-19 day. You see. Okay, Usman, your call don't cut, but maybe if you go for call back, it goes sweet well. Make we hear what you talk. Okay, our time not too plenty, so we go. Still, they put eye for inside our WhatsApp portal. Make we read the messages we don't come in from there. This was say good evening, Simple M, and good evening, our ordinary president. Thanks be to God Almighty for His mercy upon our lives, for answering our prayers. This pandemic will get away from our lives. We appreciate the Lord, Osiwa, and all our Brekete family all over the globe. We thank Una, Mama and her grandchildren, Miracle, Tabitha, me, John, and Mama T-Boy, extending our warm greetings to everyone. We should keep on praying, please. Sonny from Jos. All right. Thank you very much, Sonny from Jos. Hello.
Hello.
Yes, good evening.
Good evening, sir.
Yes, now who me and I'm Devano?
My name is Timothy. I'm from Kubwa.
Timothy from Kubwa. We hear you.
Well done, work, sir.
Thank you, my dear brother.
I just call you to greet because you can make us get the experience for this COVID-19.
All right, thank you.
Thank you, sir.
All right, thank you very, very much, Timothy from Kubwa. But at least I get your name. That one, now important pass. All right, so if you send us message, I beg, make you remember to put your name, all right, and where they write from. So like Timothy from Kubwa, that way we're going to say now you because it goes sweet, make we know who we and them they talk. If they send us message, we don't know who send them. It can't be like, say, we just they talk to ourselves. I will say, good evening, Simple M. May God bless all Brekete family. Thanks for updating us daily on COVID-19. Please, I want to know the total number of COVID-19 in Adamawa, the discharged, dead, and active ones. Betty from Yola. All right, my sister Betty, no wahala. Now, because of people like you are there here, make I give you the numbers of the new cases for the cases for Adamawa State, and from the record where they from my front, we don't get any new case today for Adamawa State. So that one they very, very good. Okay, so Adamawa State, make I even check the last time where we see new case from Adamawa. All right, make I check from the long form. Okay, 13 days now, almost 2 weeks, no new case from Adamawa State. So that one day very okay. Well, the total number of cases for inside Adamawa State now 185 cases for inside Adamawa State, and for Adamawa they don't discharge 123 people. All right, so 123 people now they don't discharge for Adamawa State, and 12 people been die for inside Adamawa State. All right, so the active cases for inside Adamawa State now 50. So my sister, hope say that one it don't answer your question where you want to know how far about this night. Okay, this message say, hi man from zone 6, I wear my face mask, still talk to clients. Why are you and your guests not wearing face masks on radio? Well, we're in a contained environment, and we have distance between us, so that one no day necessary. Thank you very much. Hello. 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 All right. I be like say the person where the other end of the line, no, they hear us. All right. This was to say, good evening, Simple M. My name is Aisha from Katampe Extension. Please, I want to ask all the campaign governors are doing. Please, did you see any social distancing between them? Because I do watch them on TV and I see no social distancing. Please let them free us. We kept saying we are the leaders of tomorrow, but I'm not seeing any leaders because it's as if they want to spoil our future. Please let them help us so we can go back to school, and let it be this year. All right, my sister, what is safe for you to go back to school? You'll go back to school. That's what it is. Hello.
Hello, Oga Maddox.
Yes, good evening.
Yes, now Usman from Tungamaji, my credit finished that time.
All right, we hear you, Usman.
In fact, sir, I say I like the way your guests explain why people know they believe say COVID-19 day. Even as school resumes, so for SS3, Hello, sir.
I didn't hear you. Go ahead.
Even as school resume for SS3, make them write their exam. So they gave school so many protocols where they go they follow. But I expected government to the same people make that they check whether schools, especially
where they expect that be the monitor.
Whether they monitor all these things, that they check them. But in some cases, schools don't see anybody to come there. So, and as they write this thing, how many states don't go to test these children to know whether the COVID-19 they are, they. So that thing just surprised me. Thank you so much, sir.
All right, thank you very much. I really appreciate your contribution. If you send people work It's supposed monitor how they do and make sure say they do what you tell them. And I suppose I want believe say they get monitoring unit people where they go around. If they don't get, they really need to do that. Hello.
This is Beatrice.
Okay, Beatrice, where are they Vano from?
From Buhari.
Buhari. All right, Beatrice, will they hear you?
I want to ask you a question.
Go ahead, my sister.
That place they are doing campaign, there is no youth there.
So youth there now, of course. In fact, most of them will be youth.
Is it first to do campaign with the youth? And you are saying it's not safe to go back to school. They should stop keeping us at home.
He said, I am saying. I did not say anything. Beatrice.
You said that they said when it says.
Okay, I said they said, Abi. So quote me correctly. I didn't say. Not be me, they make the rules.
Now you they give the information.
Okay, you know what's going to happen, Beatrice? Beatrice, you know what's in because of people like you, I go stop this program. I'm not going to give information again so that you not go come back to attack me.
They pay you salary. They collect salary.
So I'm going to collect my salary. Let's work. You know, go come my house again, enter my sitting room, they quarrel me again. Now, waiting be the issue. If something they vex you somewhere else, carry am go meet the person where you and I'm the vex. No, carry am come here. This one no be where people they carry other people vex come here. This place no be rant room. I beg. Thank you very much. Hello.
Hello. How are you?
Yes. Good evening, Rahumi and Amdeva. No.
Yeah, it's Khadija, Baba.
All right, Khadija, we hear you.
Okay. I'm so happy to speak with you this night. You know one thing? Need for students, I don't know what help that the federal government is going to do to them.
Okay.
Because even our neighbor today, she come to my place that she will start with face mask. But her mom is not around.
Okay.
So I have to buy 2 face masks for her.
Okay.
Yeah. And for, they have to put more security for this coronavirus.
Okay.
Can be less. Everybody can be free from corona. One thing, but like they used to handle the people that they did not see with face mask, today where they catch the person, tomorrow we not repeat it again, you see?
Okay.
They have to put more security, I'm telling you.
All right.
Till I call it, bye-bye.
All right, thank you. Okay, what thing should they talk? We say maybe they do for more enforcement. If they catch somebody today, punish them. Say wear face mask. The person no go repeat them. But when people they do them steady, nobody catch them or stop them. Then they go feel say nothing. They happen. I was supposed to say good cold evening to you, Simple M. My name is Henry. I am in Kefi. I want to encourage Nigerians to be steadfast. This pandemic will also pass like other challenges. I also want to thank Brekete family. I wish to meet the ordinary president someday. God bless you all. All right, thank you very much, Henry. Help us also greet everybody for Inside Kefi. Hello.
Hello, sir.
Yes, good evening.
Good evening, sir. I'm Gambo from Pandana.
Okay, Gambo from Gwandara.
Panda.
Oh, Panda. All right, Gambo, will they hear you?
I don't know why.
He said, hello, Gambo?
I only blame you for this matter.
So, you don't say some people no go find person where annoy them, they go, na me, they go find. Waiting, I no go kill myself now. What do you want to make I do? She the vex say I carry information come. I don't understand where that kind of vex come from. So, what did I go do now?
I'm glad you that you are patient with them. Boy, continue to give you their patience.
Amen, my dear brother.
Thank you, sir. Bye.
All right, thank you very much, Gambo. I give you message. I give information as I see him. If they attack me, what did I do? Hey, it is well. I no go run. All right, this person say concerning Nigerians not believing that COVID-19 is real. I think it is true. Anyway, it's not. This is your grammar, okay? Because they have not been showing us that we don't go past these kind of stories. I beg, which can show you picture. Carry your own picture. Come, tell us the disease where you don't get before. Make we show everybody. Hello,
Mr. Madam.
Yes, good evening.
Good evening. Well done, work.
Yes, Nahumi and Amdevano.
Alberca from Nasarawa State, specifically Kokona local government.
Okay.
Uvangwari, other development area.
All right, my people for that place. How are you?
Please, my own is only to plead to all fellow human beings. It's not all things that you wish you get.
True.
But you should put in mind that anything that is coming, it will be ready to fight it back. That's what we are now expecting. We do not expect that in this world something will come generally like that. But it has come already. So let us just be patient and obey the federal government or any kind of government so that we wish it to bypass.
Yeah.
That is the only advice I have to give.
All right. Thank you very, very, very much.
Thank you.
All right. All right. Al-Barka from Panda inside Nasarawa State. All right. Thank you very, very much. I think that one advice where everybody's supposed to hold to heart. Patience is key. Many people don't rush. When they rush finish, they still wait for others. Some people even don't rush. At the end of the day, the rush no come what's the whole effort where they put inside. So for me, I go talk say, no government, not even our own, go and punish us by the restrictions where they put on ground. Schools, some countries don't cancel their school year. Talking until next year their students go back. Our own still they make efforts, make we go back school, and people still they complain. All right, this one will be our last call this night. Hello.
Hello, good evening.
Yes, good evening, Nahumi, and I'm Devano.
Devano with Yusuf Yakubu.
Yusuf Yakubu, where are you Devano from?
I come from Abuja.
All right, Yusuf, go ahead.
Yes, I call to appreciate the good work people are doing.
Thank you.
Yes, sir. So I have a nice day. I have to appreciate you people.
All right. All right, thank you very much, Yusuf Yakubu. All right, so Unano say after this program, the next program where we go carry come na Nigeria A to Z, and I go rearrange myself, come back so that we go do Nigeria A to Z together until they reach the hour will be 11 o'clock. As no day around, make I hold chair for her until she come back. But anyway, as it be, make I try squeezing just one more call, so that I no go wait too much. I go come back. Hello.
Hello.
Yes, good evening.
Good evening, my brother, Simple Magos.
Yes, so Nahumi and I'm Devano.
I'm Noye from Madala.
All right, Noye, how you did today?
I did fine. Yesterday I call, you no connect.
Hey, yeah, sorry. Are you don't connect today?
Because I want to choose that woman, then say they rape her that yesterday.
Oh, okay. Oh, yeah, now come back for Nigeria A to Z now.
Okay.
All right.
Well done work.
All right, thank you, Nonye. All right, okay. Nonye, they talk about what we talk about another program yesterday. So I carry my kayak come out from studio and top COVID-19 citizens feedback this night. But don't forget to say tomorrow we will still come back with more COVID-19 citizens feedback. But before we come back, remember, say COVID-19 is real. You know, they look face, and the user fit get them, you know, go die. But now the person will go get them from you. Now that person go be the person will go carry the headache of the fact, say you get the virus, can't give them. So make all of us just be very careful, because if you care for people around you, you go also care, make you know they careless with your life this period. And we don't talk not only the things where you see with your eye, you go believe. So make all of us, I beg, do the right thing so that all of us go day okay. So on behalf of the ordinary president, Ordinary Dr. Ahmed Isa, Osiwa, and every other person we don't participate for this program one way or another, even as you see don't listen or watch, we thank you, and we pray say you go come back tomorrow, make we do this again. But of course, Nigeria A to Z now the next program, and I go day here, make we carry us walk around Nigeria, make we see all the things where they happen for all the corner and corner where they for Nigeria. Right, till tomorrow, when we come back for COVID-19 citizens feedback. Una. Bye.